Okay, all set. Good morning. On such a dark and rainy day, it's a little bit depressing out there, but I'm super happy to have a ray of sunshine in the house, which is you, Maguelonne.
Thank you. Thank you so much for that. And I would say we have two rays of sunshine for sure, and I hope many more.
Thank you. Anyway, yeah, we have a talk today, this coffee morning. We're waiting for people to join still, and we may actually see that lots of people watch this at a later stage. We have quite a triggering topic today. We're talking about challenging births, and as a birth doula, I see a lot of really beautiful births, but I also see a lot of births that are quite difficult to process, clients who have to change plans, who feel that they're not in control. All of these things, are not uncommon. So I've invited Maguelonne today. Maguelonne, you're a counselor, you're a parent expert, I would say. You give a lot of parenting guidance and so on, but you are also specialized in a technique for processing trauma and difficult situations, difficult feelings, hard emotions. And so we are going to ease into it, but at the end, I'd really like to ask you a lot of questions about this technique that is quite unique, and that can help a lot of our moms and actually parents in general out there, because it is not just limited to moms. But maybe give us a little bit of your background yourself so that we can see where you're coming from and what your credentials are, basically.
Yeah, no, sure, no problem. So yeah, so first I want to thank you for actually bringing that topic, to more awareness, because I think around birth and probably as a birth doula, that's what you see, right? Of course, birth is a big thing, and we expect it to be major, but a lot of people, because it's major, they actually dismiss a lot of things that's happening around birth. And I think that's a little bit sad, because a lot of people just deserve to feel good all the time. And that's what we're going to talk about today. But yeah, so how I came to that is actually a lot through my parenting work. Because at first I was really mainly working with parents who had challenges with their kids for anything. So it could be tantrums, it could be this and that. So yeah, so you actually talk, and I always talk, especially in the intake session, questions about how was your pregnancy and how was your birth. And sometimes you have those parents thinking, oh, that's a bit strange. My child is 6, so how come you go so far? It was such a long time ago, and how come you just ask those questions? But I do notice, and I do feel like often what happens around pregnancy, birth, and right after, especially in the first year, it does have an impact on what's happening later, especially if you face challenges. So that's mainly how I started to be more into, okay, what happened for, so of course we're talking a lot about the mother, but as we're going to talk about today, it's not only the mother, because when we talk about, and let me say the term now, the trauma, because sometimes it can be called traumatic experience. Yeah, it's not only the mother, it could be also a lot of other people, including the partner. So yeah, so that's basically how I came slowly to not work only on parenting issues, but also more counseling, deep issues about what happened for yourself, because it's not only what happened during the birth, it could be also things that happened before that, right? And going to, well, use techniques and tools that can help parents overcome those traumatic experience or challenging experience. Could be birth, of course, we're talking about birth, could be other stuff. And those techniques can really help to actually move on. So not forgetting, not just dismissing, but actually integrating those memories so we can actually use them and move on and grow from that. So that's really how I came to that. So as you mentioned, I'm a counselor, and the technique I'm using, it's called MEMI, Multichannel Eye Movement Integration. And it's basically helping the brain reprocess trauma. So it's evidence-based technique. And yeah, I'm happy to talk more on how it helps. But yeah, that's basically, in a nutshell, how I came to focus also on trauma, not only on parenting issues and individual issues, but also on trauma.
Amazing. Okay, but before we go any further, I want to just share that this is obviously a challenging topic for many, and it might be quite triggering for anyone who has had a traumatic or a challenging birth. But it might also be triggering something that came way before that, that's not necessarily birth related.
Yeah, absolutely.
So
yeah.
I'll let a little bit, yeah.
Yeah, so as you just mentioned, I mean, you never know what happened for people, and often it's because it's unconscious processes. Often, the person itself is not sure what happened and why you can be triggered by maybe some emotions, some various triggers, right? Or even words or, situations. And what I want people to know is if really at any point you feel overwhelmed by the discussion, because yeah, we're gonna have to talk about sensitive stuff. And if you feel like it's too much for you, well, your well-being comes first. Meaning, please take a break. It's totally fine if you need to stop, if you need to breathe, if you need to step away from the recording, and care for yourself. Please do that, because that is the number one thing we do when we feel like maybe we went under a traumatic experience and we're still feeling the impact of it in our life right now. And I also want all moms to know that I hope, of course, I talk for myself, but I guess also for you, Johanna, we are always here to talk about stuff. So please do reach out, because sometimes it's just a small talk. It's just like just a short discussion about what happened that can just help, release some tensions, and that's all that is needed. And sometimes we need more, but actually taking care of yourself is the number one priority. So that's what I want moms and not only moms, everyone to remember.
Understand, yeah. And I do really think that at the beginning, when you're in the midst of your postpartum period and so on, it can sometimes be, it's easy to brush things under the carpet because there's so much happening in these first weeks and months. And so that we don't sort of take it seriously and we don't address it, but then it surfaces at a later stage, and we absolutely must address it, I think, because for some moms, then it impacts their daily lives, but others, it might impact a future pregnancy or it might just come up in a future birth. So we'll talk about all of that as well. So Maguelonne, my first question to you will be, why do we have to talk about this?
Yeah, because for a lot of people would be, well, giving birth, we've been doing that for, so many generations from dawn of time. So, how we should know about it. So why do we have to make just a fuss about it, right? Yes, of course, it's a major experience, but what do you expect? And obviously it's a major thing. Just get over it, and that's it. We have that idea. And I feel sometimes also as a woman, as a mom, that sometimes the birth might be the first time when we start to dismiss our feelings to prioritize our kids. And that might be the first thing we actually do, because when we're pregnant, we do know we need to care for ourselves. So we do know that, right? Because it's caring for our child. But the minute the baby is out, we have that feeling that, okay, now we focus on the baby, and then all everybody is going to look at the baby, and we're going to look less at the mom, right? And even the mom herself might actually do that. And again, working with a lot of parents, that what I see often, and so I'm doing conscious parenting, and for me, being a parent is not just forgetting about yourself. It's like integrating parents, your personality, your what comes from you with your child, so both of you can grow. It's not only the child who's growing, it's also the parent. So sometimes I do have that feeling that the birth is the first moment when the mom starts to, okay, put herself aside and focus on the baby. And of course, you have moments where you have to do that. Of course, you have a newborn, you have to care for your baby, and you have to feed your baby. Maybe sometimes before you need to pee. That's the reality of it. But what I'd like is for moms to still have that awareness that, yeah, I need to care for my baby's needs. Sometimes we can have very high need babies, but caring for myself is also important. So number one, is because basically everyone deserves to feel heard, supported, and safe, and to be in an environment that they can heal and thrive. So that would be the number one. It's true for everybody. But what also is important is to remember that also for your baby, because in case moms are not completely convinced that, oh, yeah, I need to care for myself. Well, actually, caring for yourself is caring for your baby. Why? It's because when you have mental health for moms and for dads also, but of course, we talk a lot about maternal well-being in the first few weeks and months and actually years of the baby's life. The baby will grow healthy in body and mind. So if you want to look more into details, it's called the first 1,000 days of the baby of the brain. And it's like basically from conception till roughly 2 years old, the brain will be shaped and evolved in such ways that what happens during those two first years, during pregnancy and those two first years, can have a very, very important impact, positive or negative. So caring for yourself is caring for your baby, right? And also there is a lot of studies showing that there is a lot of links between traumatic birth and postpartum depression. And we know that moms with postpartum depression maybe have more to add on that, right? But is actually something that is not good for yourself, but is also, it does impact the baby. So, and also if it happened to you, moms listening to that talk today, please don't be like, oh my God, this happened to me, I got this. Everything, we can always help, we can always heal yourself, heal your child. Anything is possible. The brain is plastic, we can always do something, and there is always hope. So I want also moms not to like kind of freak out or feel like, oh my God, that happened, now I realize that happened to me. Well, it might, but we can always do something about it.
Yeah. And I also find that those, any mood disorders, but especially in the postpartum period, carry a bit of a stigma as well for some. And some moms might be afraid to speak out because not suffering from that and having issues, finding something challenging might mean I'm not a good mom. Does that mean that I'm not, the best mother my child could have, and so on? And it is not just postpartum depression as well. I want to say that too, because I think a lot of what we see too is anxiety and OCD and the panic attack that comes with my child running a fever or whatever it is. It's when we have lived a traumatic experience, I think we tend to catastrophize often too. And that in itself is something that people might need help with too.
Yeah.
So
yeah, absolutely. Yeah. So it's also talking maybe about the myth about trauma and more specifically about birth. So this idea that, oh, if my baby is well, then I shouldn't complain. If everything went okay, I mean, medically, if there is no complications, then why should I complain about? Even if maybe I felt something, I felt like maybe some pain or maybe some discomfort that was not known to me before, something like so strange and new and very overwhelming that I didn't know how I couldn't use my normal, my usual coping mechanism to deal with that. Then it can make you very of course stressed but overwhelmed by the experience and feeling unsafe. But then if the baby is healthy, then should I complain? Oh, I shouldn't complain, it's me, and stuff like that, right? So you have a lot of myths around trauma. So also, as you mentioned, we have the feeling that trauma is for people who are vulnerable, anxious, they have already mental issues, which can be actually also true. But not only, everybody can, suffer from a traumatic experience and then develop symptoms that we call sometimes PTSD. So yeah.
Yeah, absolutely. And I think sometimes it's you don't have to call it trauma necessarily, but it can be intense feelings. And sometimes what I see a lot is a mom preparing for a birth in a certain way, and she has this picture in mind of how her birth should go down, and she has, she has prepared and she has done all this work. and then she has to change course for whatever reason. So maybe the baby might require that an intervention, that we have an intervention, and she will grieve the birth that she envisaged, I think. And that in itself, you might not call it trauma, but these are hard emotions to process for sure. But talk a little bit about how we define trauma and what trauma actually is.
Yeah. So basically, the definition of trauma. So what you just mentioned, like, oh, I had to grieve what happened for my birth. It could be considered a trauma if you do have constant memories of it, if you have flashbacks, if you have a lot of, difficulties accepting what happened, and maybe from what happened, you feel like something's wrong. Something is always wrong with your baby. Maybe you're always, hyper vigilant, on high alert, or stuff like that. That could be considered a trauma. But often people think that trauma is one single event that is horrified. That is like that something very horribly went wrong, and it's one single event. And yes, that could be it, right? That's what we call acute trauma. But actually, you have a lot of other types of traumas, and we call them complex trauma. So it could be additions of different things. It could be maybe sometimes it's not directly linked to the single event, but the thing that happened right after. So that could be also, considered trauma. And the definition would be that it's what happens when someone goes through an experience that is extremely stressful, overwhelming, very scary, and basically when you felt unsafe. So unsafe for yourself or for your loved ones. Okay, so that would be the definition of trauma. And what I want people to understand, it's very subjective, because I cannot tell, I can go and can look at you, see you going through an experience and not saying it's traumatic, because it's not traumatic for me because I have a different story, but maybe for you it's going to be traumatic. So what is very important is for people to understand that it's not what happens to you, is actually what happened inside of you when the experience happened, and that was not processed fully. So basically, it's a question of, so if we talk about the science of trauma, it's a fight or flight response that it's unresolved. So it's like, so very naturally, everybody has to have a fight or flight response, fight, flight, or freeze response. So when I sense a danger, I sense my physical body is in danger. I will go, my brain will send an information to my body saying, okay, let's move quickly here because we might die. So let's fight the opponent, or let's flight, let's escape. Okay, let's run super fast. Okay, so that would be a very strong response that's happening. But a normal stress response, you would go into that cycle, and then the threat would go away for whatever reason, would go away. So then you are able to go back to a rest mode. So if we talk about nervous system, it would be going from stress response, which is the sympathetic branch of the nervous system, going back to the parasympathetic, which is the rest mode, when I can digest, when I can sleep, when I can rest, and all of that. Okay. But the idea with the science of trauma is more like you get stuck into that fight or flight response, because your brain still thinks that this situation might happen anytime. So you need to be on the lookout always to make sure you survive. So I think, the number one, I think, is to understand that your brain is just trying to save you. It's just like that. Your brain is trying to help you. But the thing is, sometimes the brain is focusing on the experience, not seeing what's happening around it. And if you don't process it fully, you stay on that tunnel vision on, okay, maybe something bad will happen to me, and I need to make sure it's not going to happen again. So I need to remember every little details, and which means it's a lot. Trauma is a lot about somatic. It's not so much about understanding, because, and that's also when you see people knowing they went into a traumatic experience but get stuck, because they know they should be over it by now, but they are not. So it is that I'm locked into that survival mode, and I cannot really get out. Okay, so you have a lot of things that the memory will remember to make sure that in the same similar situation, well, the brain, the body will remember, okay, when I smell this, okay, that is a trigger, that is maybe a danger, I need to react. When the situation is happening, I need to react. When I have that kind of feeling, I need to react. When I'm near this place, maybe a danger will happen, I need to react, okay? So every time, all those triggers that could be very often unconscious will send the person to a fight or flight response, and you don't have access so much to that rest and digest mode that, of course, everybody needs. So that would be how the trauma, how we explain trauma.
Yeah, and then you were talking about the somatic signs. What are the physical symptoms of stress? How do I know that I am in this fight or flight mode?
So you have a lot of different signs. So generally in trauma and in MEMI, we looked at 4 specific criteria. One would be intrusions, which is basically when you have flashbacks, or somebody's talking about something that is unrelated to that experience, but suddenly you don't know why it pops in your mind. Okay, so these kind of things, when it happens often, then and often is, I mean, of course, it depends on the individual. When it bothers you to a point that it impacts your life and what you're going to do, that is when we consider it's a problem. Of course, avoidance is another criteria. When you start to avoid situations that might trigger stuff, or you might feel, okay, it might be an issue for me, it might be challenging for me, so I don't even want to go into that situation, or go through that. So when you avoid, that is a big flag also. It means there is a trauma and I'm still trying to avoid, which is, by the way, not helpful when you deal with a trauma. The idea is not to avoid, the idea is to kind of face it, but maybe I go through that again when we talk about how we treat, right? And how we go through that. Then, of course, it's a lot about your emotional state and your cognition about it. So it could be thoughts, beliefs that that are still in your mind, running in your mind, and you try to make sense of, okay, what happened, and you playing in your mind again and again and again, what happened, what could have done differently, so it happened differently, and stuff like that. Okay, so when you play things in your mind, when you have some kind of ideas that keeps, or beliefs that are staying the same, and you have emotions. So emotions could be, of course, worry, anxiety, but it could be also sadness. It could be numb. You can feel numb. You can feel nothing. A lot of people actually feel nothing, and it's a way to protect themselves, okay, from the big emotions. So a lot of mood swings that could go with the trauma symptoms. And then, of course, you have the arousal state. So when you are easily startled, when, some people say stuff and suddenly you feel your heartbeat coming very fast, and breathing, and you feel like very quickly your whole body is reacting to something that actually maybe you shouldn't react to. That could be also a sign. So that would be the signs. So to sum up, you have emotional signs, you have physical signs, and you have behavioral signs. So behavioral being, for example, avoiding stuff. Emotional would be like strong emotions that you cannot, you feel those emotions more often than not. And physical signs could be something actually, tension in your body. Okay, sleep disturbance, loss of appetite, or eating more. All of that usually indicates that something is going on. Of course, I know that when we talk about birth trauma, changing appetite, having your hormones ups and down, and mood swings, and sleep disturbance because you have a newborn, well, actually, that's a given pretty much for everybody. So yeah, I do understand that it can be difficult to make the difference. I would say when you are willing to explore what's happening for you, you can make the difference between I'm exhausted because I have a newborn and it's very exhausting and all of that. But I'm still happy to be where I am. And when I actually pause a little bit and, I feel grateful and I'm happy where I am. And also when you have more feelings coming that maybe are less positive about your experience. And also you can be grateful to have your baby and having like a lovely baby experience, and also being feeling, that the birth or whatever experience around the birth, before, after, because the birth trauma is an umbrella for a lot of things, even before the birth or right after. But yeah, you can also feel that, right? It's okay to have mixed feelings about your birth and your experience.
Yeah.
Very normal.
So let's talk a little bit about what causes or what could potentially cause birth trauma. What are risk factors for a mom for a mom suffering from birth trauma? Because it's not just the birth itself, it's everything around it as well. And sometimes it's in subtle situations as well that we might not be aware, that another person in the room might not be aware of.
Yeah. So that's the thing, right? Trauma is what happens to you. It's not only what happens to you, but it's how you process it. Okay. Which means that it's very subjective, and you might go through what medical staff can think as a very successful birth. It was very fast, and and everything, and maybe your friends say, oh, you're very lucky, it was so fast. But maybe, as you mentioned, your expectations were different. Your expectations were, I need to have some time to adjust to different stages, and I thought I would have some time, and I didn't. Okay, so again, you have a lot of factors. So I'm going to go through the factors. What I just want to say to moms is, not because you didn't have what is supposed to be a complicated birth, that you didn't have some kind of challenging experience, and you are totally allowed to feel that way. Okay, but yeah, of course, when we look at studies, we also see a lot of links between what we call complicated birth, so medical complications, and maybe that's also when you can come in with your experience. But emergency C-section, losing a lot of blood, the pain, maybe, and lack of control of what's happening, forced intervention on yourself, on the baby, unexpected procedures, of course, postpartum complication. So if your baby needs more support and ICU stay, breastfeeding struggles maybe, and stuff like that, the baby not putting on weight as the baby is supposed to, and all of that, yeah, that can be also what we consider challenging experience and birth trauma. And as you mentioned, reality not matching expectations. So if your plan A is to have a non-medicated birth, but you end up with an epidural, maybe you feel like a failure. Maybe it's difficult for you to feel like, oh, how can I be a good mom while having, non-medicated birth was so important for me, but I couldn't do that for my baby. So how can I be a good mom? You can have all those kind of things popping into your mind, and if you don't have space to process it, it might just come back and circle instead of addressing it, seeing that it's a fear and it's okay. Everybody goes through different difficult situations. It's okay, we can learn from those and we can bounce back.
Yeah. What I also want to mention is that it's interesting to see too that different people in the same room can have a different perception of what is going on. And so often the mom is in a very different situation than the dad. They are on different ends of the spectrum in a sense. She's going through something and experiencing it very differently from what the partner is seeing, basically. And I find that a lot of difficult situations, also we struggle with the fact that there is no communication. Nobody is explaining what is happening. And that can sometimes be so difficult because you might be completely misinterpreting something that is very normal and common, but you can't place it anywhere because you haven't been in that situation before. And that alone can be triggering, and that can cause issues later on just because you don't know what's going on. And I think as birth doulas, that's where we always sort of step into the situation and say, look, they're doing this because XYZ, and we provide some of that communication and understanding that makes it a little bit easier to process certain things.
Yeah, I mean, I think you're absolutely spot on with that, because often is a misperception of what happened, or sometimes it could be a real perception, but when you know that people are caring for you, you don't feel that unsafe, even if it's like very serious situation, and you feel cared for and things, and so you can process it in a better way. Okay, and that's also why you see some people going through something that you would consider very traumatic, but they don't develop any PTSD symptoms, and they are perfectly fine, and you feel, wow, they're super humans, because it's very they really have that, you feel that resilience, right? Usually it's because they had people around them who helped them process what happened. That's why I think what you do is so important, because preparing for the birth, so also in advance, and if people ask me, but how do you avoid birth trauma? Well, actually, I don't have a proper miracle solution. It's not, I mean, you never know exactly what's going to happen, but definitely preparing for what might happen with professional who will be able to tell you the reality. So not scary stories only, because hearing scary stories can be traumatic for you. But also just like understanding what might happen, what will be necessary, and having plan A, but also preparing for plan B, plan C, etc.
Yeah.
Because when you do prepare, you feel more in control, and often the traumatic experience comes from where you feel like you have a total loss of control, you are powerless,
Yeah.
and something bad can happen to you or to your loved ones. And going back to what you said about the partner, often also we think that it's only the person who go through the event that is traumatized. Sometimes you have a mom who is not traumatized by the birth, and you have fathers or partners who actually witness stuff from, as you mentioned, a different angle. Maybe I didn't realize as a mom that I lost a lot of blood, because I didn't even feel it, and maybe my partner saw something that was wow and didn't expect that.
Yeah.
Maybe I see my partner in such a pain, I never saw my partner like this, and that's pretty scary, and nobody actually prepared me for that.
Yeah.
So being a bystander can be traumatic, and people also forget about that. So definitely when we talk about birth trauma, it can also be medical stuff, by the way, and it can be the partner. So I think we need to also acknowledge that, because the father is also allowed to talk about his experience of the birth, and just simply be like scared for my partner and for my baby. I had that dad who suddenly was going through the birth with the mom, and then suddenly, okay, emergency C-section, and you know how it can be when they decide to go. It was not in Singapore, but when you decide to go into the C-section scenario, I mean, you move fast, right? Suddenly, boom, 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 everything goes super fast. And the father was not allowed in the room, and suddenly he went through. I'm with my wife, helping my wife to give birth to our first child. To I'm waiting in the corridor, not knowing if my wife is going to make it, because that was what had in his mind. And you can understand it can be traumatic.
Totally. And that happens more often than not, that the communication is just not there. So I often discuss that with managing expectations as well, even in moms who go for a scheduled cesarean, and then things are just delayed for no reason, just because the anesthetist was stuck in traffic or whatever it is. But we could catastrophize waiting in the postpartum room and thinking, why is this taking so long? She should be up, it should have been brought up already. And so we spiral out of control a little bit as well. So what are we talking about next?
Well, I think maybe also just the maybe last point would be, even if your birth went super well, but you feel like nobody is really taking you seriously. So you mention your pains, maybe your discomfort, and people say, yeah, it's normal, it's because you're giving birth. So maybe feeling dismissed. Maybe I know also that mom also going into a C-section, And so it was emergency. It was, okay, the baby, after a number of hours, baby's not coming. Okay, most probably now we're waiting for the doctor, but probably it's going to be C-section. And the mom burst into tears because it was not what she wanted, right? And the nurse was like, oh, come on, it's not the end of the world. It's just like C-section happens, every day. So, it's okay. It's not, the baby is fine. So feeling dismissed when you go through those kind of experiences and you have a nurse that, or maybe a nurse or maybe somebody, it's like, okay, come on, get over it. Not even giving the time for that mom to actually, as you mentioned, grieve the fact that she was trying for so many hours. And now the verdict is like, okay, no other options, we go for C-section. So I think feeling dismissed, even if everything in the end is well and everything is well, I think it's important to understand that I could cause those traumatic feelings, and maybe we can bounce back on the myth about traumas and this idea again that only very bad experiences can cause trauma, and also this idea of if the baby is well, you should be grateful and stop complaining.
Worst things you can say to a mom, I think.
Yeah, absolutely, yeah, right. And also, so we have a saying in France that we actually also use for kids that is very typical of that, which is basically to say that if you had no physical harm, then it's not serious.
Okay.
Yeah. So it's like, so in French it would be plus de peur que de mal.
Okay.
So the idea of if it's only fear, it's fine.
Yeah.
It's because what is most important is physical harm, and what we take seriously is physical harm. And I think that says a lot about how we see fear and how it can impact and how it can wound yourself, even if it's not visible to other people. And I try to really go against that because it's definitely not helping. You have also that myth that time heals everything. So if you give it time, you will feel better. And to be fair, in some cases, it's actually true. Times help for sure. But it's also not recognizing that for other people, it's not. And when you talk, so I was speaking to somebody kind of recently, and it was not about birth, right? It was something else. Again, like more parenting. But then when I ask questions about the birth, I see tears coming in the eyes. And when you still have that feeling of and not tears of joy, like it was the best day of my life, right? It was everything that came with it. It was actually, maybe that's what we can talk about also in trauma. It was a birth during COVID. So time was very difficult. You couldn't have your doula, your partner. You had to have mask. You couldn't have any visitors and everything. So it was a very traumatic. Plus the scare of what if I catch COVID, and what if my baby catches COVID, right? So it was that time. So you see, it's not recent, right? It was like 5+ and 4+ years. But yeah, so talking about that mom, you could see the emotions coming up. You could see the tears in the eyes. So when people say time heals everything, well, actually, definitely not for that mom. And she's not alone, for sure. Because a lot of stuff happened. And even though she can understand why it happened and we can make sense, COVID, the decisions we had to take and everything, it doesn't mean it's not a wound still for her and the way it happened. Okay.
Yeah.
So this idea of you should be over it by now. If you don't, or if you don't remember it, then it didn't affect you. Well, actually, that's a sign of trauma, because often in the memory we actually dissociate, and then we forgot parts of the experience, and that's a big sign of trauma. And it's just your brain protecting you. So the idea is not specifically to recall everything, but it's to have that awareness and see how you can reintegrate that memory. Because when you integrate the memory, you can let it go. And that's what we need. We don't need to forget. We need just to let go So those experiences don't have impact on us in our present life.
Yeah, exactly. And sometimes it doesn't affect us daily, but we might get into a situation where it does trigger it, you know, and we never know when that might be.
Mm-hmm. Yeah, so maybe giving an example of that, I was that mom also I worked with where she was extremely triggered when the toddler or the 4-year-old was like asking for stuff, like, you know, asking, you know, like for stuff. And she was very triggered. And like when you start to go into what happened, you realize that that mom had a C-section. And the first few times when the baby was crying and she was describing, my baby is crying, I'm alone in my room, the baby is crying, I cannot even move and turn because it's so painful. So
Yeah.
my baby is crying, asking for help, and I'm not even there to give what my baby.
Respond. Yeah.
So and to respond to my baby needs. So then the trigger is also every time my child is screaming or crying, it brings me back to that moment where I was supposed to be there for my baby the first few hours, and I couldn't because I was so much in pain, and I blame myself for that.
Yeah.
Okay. You do have, so sometimes it doesn't show up as a birth trauma, but then you can see links with what's happening in the relationship later with the parent, with the mom in that case.
Interesting. And then, so what are the resources that are available for moms who think that they've gone through trauma, or for partners who think their partner
Yeah.
do with some help as well, because it affects both, as we said?
So I would say number one, especially if it's close to the birth, talk to your doctor, talk to your midwife, talk to your doula, explain that you've been having those hard times, and see if they have resources they can share with you. Okay, because they should be able to direct you to professional therapists wherever you are. So I think it's very important. There is also the Postpartum Support International organization that can be of help. So I think that would be number one thing, do that, right? But if we then talk about like treatment options and what we can do to heal, then so for trauma you have a lot of different options. I want to focus on the evidence-based ones and the one actually that we usually go to first. And as you maybe remember, I mentioned that trauma is a lot about avoiding. So there is this idea that when you stop avoiding and you face your trauma, your fears, that will help you, basically process the trauma and get over it. Okay. And in some cases, and for some people, is actually true. So you have a lot of techniques which are basically to expose you to what happened. So recall, relive the event, so we can actually, because you relive the event, go through, let it go. Okay, so that would be psychotherapy approaches such as just talking with your counselor, just talking about the event, recalling details, in this idea of when you bring things to your consciousness, then you are able to understand it, so you can let go, and which actually can work, by the way, and in many cases it works. So you have also what we call CBT, so cognitive behavioral therapy for trauma, and this is exactly, the idea. It's identify and change negative thought patterns about the trauma, which means we need to talk in details about the trauma. You also have something that is very well known now. It's called EMDR, which is eye movement desensitization and reprocessing. And the idea is, I'm going to help you reprocess your memory by connecting with both your side of the brain. So when we disrupt the pattern, we help you reprocess. Okay, so that is very evidence-based method, and it's actually really working. So, and then you have, of course, other approaches that I also recommend, and you can try things that depending on what works for you or not, but you can do yoga, somatic work, art therapy, group talk, mindfulness. You have a lot of other methods, and And I think basically everything we talk about self-care is actually useful, and it's something you should anyway learn to do, and learn to have a lot of different resources. So the method I'm actually practicing with people coming to see me for trauma or for anything is actually called MEMI, so multi-channel eye movement integration, and that's actually a new method that's adding on EMDR. So we're also using that pattern when we're moving eyes, and so using bilateral. But the main difference with EMDR would be that one, we don't ask, we believe that for the person to get over the trauma, they should be very comfortable. So we emphasize on the comfort of the client, which means we don't ask the client to say the whole story.
Yeah.
We just say, okay, give me a TikTok version of the story. So very simple thing. So I kind of know what happened, but if you don't want to go into detail, you don't have to, which makes the person very comfortable, because sometimes you can have stuff where you feel embarrassed and you maybe don't want to share, which is totally fine. And then, so you don't have to recall all the details. We don't ask that. And we're going to use, so moving the eyes, which gonna help disturb the pattern. So if you remember, I mentioned trauma is being locked in survival mode. So you are locked into fight or flight. So it's like you are in your limbic and reptilian brain. So when we make the eyes moving from one side to another, we help the person to trigger the cortex, with cortex and both hemispheres, which means we had to disturb that pattern that is only in the lower brain. And that will help to make people actually open up to the experience, and using patterns that are more beneficial, so you can integrate the memories and you can actually move on. Okay, so it's not about forgetting. It's not about I'm not making people forgetting about their experience. Whenever they want, they can recall it. It's about not running the show in the background. It's really about that.
Yeah, and it's avoiding a re-traumatization, I guess, as well, right? Because that can happen. As doulas, we know, lots of doulas think they should be debriefing and so on. But I think often by doing that, especially when you're not trained as a counselor, you run the risk of actually doing more harm than good. So my question to you is also, is there a right time when it is the best time to deal with birth trauma?
So I think the right time is when you feel the need. I mean, in theory, right after would be the best, right? As soon as possible is the best. But sometimes it takes some time for you to realize, okay, I can sense that this experience is not leaving me in a way that it's now a memory. It's actually still somehow always in the background and making me, it impacts my everyday life, or almost everyday life. I don't do this kind of stuff because it make me talk to people that might remind me of that, thing. I might just avoid going to hospital because hospital sounds, it's not a good place to be, this kind of thing. So, but I would say as early as possible, if you can, again, you can heal even years and years after what happened. So even childhood, so we work a lot on childhood trauma, because MEMI is a great way to work on traumas when you have fragmented memories. So you don't remember everything. It's a bit blurry because it's from childhood. It works very well because you don't have to remember everything. You don't have to talk about it. Okay, so it's very patient-centered, emphasizing on the comfort of the person, just going to your pace. So it's beautiful to integrate MEMI in counseling sessions, for example, because we can talk around maybe what happened. And the way I would work with people is, of course, always first understand what they want to work on. And slowly, not if I sense there is maybe a trauma somewhere and the person is not ready to talk about it, I won't push. I would just leave some space for the person to feel safe and secure. Because number one, trauma is you don't feel safe and secure. So to heal from trauma, you need to feel safe and secure. And then I might, offer to do a MEMI session if I feel, the person is ready. One important condition for MEMI to work is to feel like you are ready and you want to move on. So when you feel like, okay, this is bothers me to a point that I feel like I cannot really fully live my life and thrive, and I know it shouldn't, or it shouldn't. I know I should. I want to move on, right? So when you have those conditions, that's when your brain is ready. Is you just need to get unstuck, basically, physically.
And are there any contraindications? Any situations where MEMI would not be useful or wise to use?
MEMI is very safe because it's about moving the eyes. So it's very safe, and MEMI practitioners are trained to actually really go to the pace of the patient, never push. Stop and try again later, or So it's very safe in that sense because it's basically making the person moving the eyes. So not really contraindication. The only issues would be if you work with somebody who is not able to focus for whatever reason. So I would say high, very difficult mental health when, some people cannot understand your instructions and cannot follow your instructions. For like a MEMI session usually is around 1 hour, something like that.
Okay.
So that would be the kind of contraindications. But for example, I know some people have worked with people who are don't see well or completely blind. You can still make the eyes move even if you don't see. So that's the beauty of it. It's very impressive. Yeah, very impressive. So not many contraindications. It's mainly that the person is willing to try, is willing to move on, and can focus for a little while and can follow instructions. So we actually work with kids also.
Yeah, I was going to ask you too, is because I know that maybe you've shared with me previously when we met that it is not actually just for trauma. What are other applications of this technique?
Yeah, so you can actually work. So in my experience, I worked with some phobias or some anxiety. I worked with addiction, some addiction. And when you actually understand it, often the root cause of, for example, addiction could be a kind of complex trauma, could be from childhood. Often it's from childhood. It's not always like that, but it could be. And you realize that you can help. So I worked with, I can share that I worked with actually my son, who was kind of traumatized to, speak in front of the class, because that can be when you 8 or 9, that can be quite scary. And he had, yeah, right. And he had probably an experience with a teacher because he didn't know his poem. And then he felt very, very stressed to the point that he was avoiding such as, I'm not even looking at the poem, so I actually don't know anything. So when I'm asked, I'm getting re-traumatized, okay? So I worked with him with MEMI, and I knew he really wanted to feel better about that, because that's not a situation you want to be in forever. And that was actually more than a year ago. And actually, I can tell you now, he's doing presentations. He's actually happy to work on his presentation. And he's telling me stuff like, oh, I feel a bit nervous because I have my presentation today. But then he just goes. So it's not like he completely disappeared, and it's not supposed to, but his way of seeing that is very different from where he was, almost 18 months ago. And I can see he's not avoiding anymore. And actually he's kind of excited, a little bit excited to, that's nervousness. Oh, I'm going to do my presentation. I'm a bit like, oh, I need to prepare, but not in a way that it was before. Yeah. So that would be an example of, it's not something you consider typically as a trauma, but can work beautifully. So phobias also, if you have phobias. So instead of, exposure would be like, oh, I put the spider in your hand and I make you, Okay, let's not talk about spiders. But yeah, So that's something you can work on.
Yeah.
Of course, the more the phobia or the addiction or the thing that bothers you impact in your everyday life, the more you're going to see a big shift, right? If it's like a small thing that doesn't make you, actually you don't like for you, if spider is a thing, but you don't think about it every day, and you it's not panic, we can work on that, for example. But right after, you might not see a massive shift. While for some people, I've seen a massive shift from before the session and after. People are deeply relaxed. People have mentioned stuff to me like, "Oh, I felt like I smoked pot," for example. Like they felt so kind of I don't know. In the way they were describing it was, I feel so relaxed. It's like there is like completely something melting down. One mentioned like she couldn't almost talk to me. She said, "I need to get home and sleep," because what happens when you have a lot of cortisol in your body, usually it prevents you to sleep, right?
Yeah.
And when you start to get those layers dissolving, she said, "I went to sleep 9 p.m. I never go to sleep so early. I had the best night of my life because suddenly the brain was like, oh, okay, we can relax now and do whatever we were supposed to do for maybe so many years, is actually sleep and rest." So I've seen also that kind of big shift. People lighting up, being able to talk about something else than that traumatic experience, and that's actually lovely to see that.
Amazing. That's really great. Thank you for sharing this with us. I think we've come to the end, but I want to say that everybody who's watching this at a later stage as well, and the parents on the call too, I think Singapore is very unique in the offerings that we have and all the different techniques that you described, including, fabulous counselors who specialize in especially birth and postpartum and pregnancy as well. But we have people who do body work and acupuncture and osteopathy that works more on a neurological kind of basis, like craniosacral therapy and so on. So please reach out to us if you feel that you want some connections, because that's what our community is all about. We know all these brilliant practitioners that we'd love to refer you to. And don't suffer in silence, really get the help that you need. And Maguelonne is super generous with giving out her WhatsApp number as well. Like, I'm happy to connect you. Please don't call her at 2:00 in the morning. But yeah, send her a little WhatsApp and just reach out to her and see if that is the right approach for you again as well, because I think it's very individual what every person responds to, and not one modality is right for everyone. So happy.
Yeah, and I'm always happy to offer like a 20-minute free call, because I think it's important for people to get to know me a little bit, how I work, and to see if I can be of help, or if I can refer to somebody that might help better. And maybe something I can also mention is I can send you my link to so I have like a questionnaire that you can answer to basically see whether your score in terms of PTSD. So that could be something that maybe some people want to have a look, just to see where they stand. And I'm happy to talk about that on the phone with them after. If they want to take it anonymously, they can, because you can just put your initial. I don't even know who you are. But yeah, if you want me to contact you, I can also. So so maybe it gives you some options, and just to see whether that could be something you want to work on, or that could be something helpful and beneficial for you.
That's amazing. We've also got a presentation that we're super happy to share with you if you would like, in a PDF format, easily sent out via email or WhatsApp. So reach out to us if you'd like that. And then I just quickly want to say that you've got a workshop coming up as well. This is separate. This is the other hat you're wearing. This is all about parenting. Do you want to plug that for a minute?
Yeah, so I'm just having my next class for parenting. So it's called Conscious Parenting Essentials. It's starting on this coming Saturday in the morning at Mother and Child, Tangling Mall. And yeah, basically we're going to talk mainly about a little bit about the brain, a little bit about different techniques for parenting, what could be useful, what cannot, and mainly how we connect with kids. So it's 2 modules. The first one this coming Saturday is more about how to connect with our kids, especially through play and understanding the importance of connection and communication skills. And next week it will be focusing more on, discipline and stuff like that. So well, it's a more challenging situations, but it's not necessarily traumatic. So definitely when we do conscious parenting, it really helps.
Lovely, amazing. And you offer the same course for helpers as well, and they are always conducted at Mother and Child in Tanglin Mall.
Absolutely.
So yeah, reach out to Maguelonne or actually Mother and Child. You can sign up both ways, and they will sign you up for the classes. Fantastic. Thank you so much for spending your morning with me.
It was always a pleasure. Thank you so much for making that talk work and bringing that awareness.
Exactly. It was much needed, I'm sure. And we'll send out the recording to everyone later today. Okay. Thank you so much, everyone. And we'll see you soon. Bye.
Bye.